Hello, and thank you for tuning into McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And today we are going to get to as many questions as we possibly can. We're going to be taking a couple of weeks off for the holidays and didn't want to spend that much time away from you. So we've pre-recorded this show and we'll spend the hour answering questions. But first, I want to say hi to you, Mom and Dad, Dr. McDougall and Mary. How are you?
We're good.
We're doing fine.
Yeah.
Lots of questions to get to, but I know there was a study you wanted to talk about. So let's start talking about that.
Should I tell people I ran a marathon this week? Yeah, it was a great week. I did not run a marathon this week, nor did I swim 2 miles. But I know there are some people my age who still do those things. I wanted to, I started to talk a week or two ago about an article that was in the Journal of the American Medical Association about taking people off medication. And let's see. Yeah, here it is. Deciding when it's better to deprescribe medicines than to continue them. It was in the Journal of the American Medical Association, and it was, I think, November of this year.
Can they all see this?
No, they can't.
Okay.
All right. But we have the link for the article if you want to read it. November 29th, 2023. And what it talks about is the fact that it's time, doctors learn all the way through medical school, residency, their noontime office visits with the drug rep. They learn how to prescribe medication, but they don't know how to de-prescribe medication. They don't know how to take people off medication. And the article talks about how patients are afraid when their doctors reduce or stop their medication, that even though the doctor may say, look, there's no benefit here, you don't have no need for it anymore, it's more toxic, you ought to take, they're afraid to stop it. And so they convey that message to the doctor, and it continues. And that's part of fear-based medicine. But the primary cogwheel in fear-based medicine is the doctor.
Well, you know what I got out of reading that article is I read that the patients were afraid that the doctor was taking them off the drug because he felt like he couldn't do anything for them, and he was abandoning them.
I suppose that's one message to give.
Because he figures, well, you're too old to take the medicine anymore. You might as well just forget it and die. And so they don't see that he's telling them they don't need it anymore. They're saying, you're just dumping me.
Well, that's one message they might get. But I think the fault really lies with my colleagues, Mary.
Oh, okay.
They're afraid of getting criticism. It's better if the patient dies with a bag full of drugs next to their bed. You never get sued. You find out that the person died of a heart attack and Dr. McDougall took them off their whatever medications that they really don't need. And all of a sudden, you're in trouble as the doctor who deprescribes. So doctors are afraid that they'll get criticized. If the family comes in and there's bags and bags full of pills, all kinds of tubes and machines, doctor did everything for you. The doctor may have killed you with all that effort. So it's fear-based medicine. And I want you to remember that term, fear-based. Another term I use quite often is faith-based medicine. You have to believe it works because you see no evidence that it does. You don't see it in your personal outcomes. You don't see it in the scientific literature. The doctor, when they read the articles, see that it doesn't work, but they believe. It's faith-based medicine. And so you get treated with the idea that your doctor's afraid of being sued, afraid of being criticized, anyway. There are a couple of concepts that you ought to be aware of: faith-based and fear-based medicine. So how do you get good medical care? How do you pick a doctor? How do you navigate this world that I've been in my whole life? And certainly I'm withdrawing from quite a bit since I've started a diet therapy practice 46 years ago, but I still have a pretty good idea what's going on. So you got all these people who are selected to go to medical school, a privileged position, by the way. I mean, that's the cream of the crop, except for maybe being a money manager on Wall Street, being a doctor. I mean, that's just so cool. And so we're considered to be extra special people, but we're not. We're just people. And you know that, in whatever endeavor you're in, or workplace, or educational situation, there are really talented people, and there are a bunch of not so talented people. And so how do you sort out the right person for you to take care of you? Because they're all not gods, or even next to gods, these medical doctors. Well, first of all, don't find a doctor. You don't need a doctor. You don't need a family doctor. I know you think you needed to have a doctor, a personal doctor, because that doctor is going to remember everything about you and know exactly what to do, because that doctor is taking care of you for months and years and so on. That doesn't happen. Okay, when you get into trouble, you go to a doc in the box, a curbside medical facility, or the emergency room, or whatever doctor's not on vacation.
Well, it used to be different though. I think I remember when I was a kid,
Yeah,
if I had,
it was the family
it was
doctor.
the family doctor. who
When they used to
came.
make house calls.
Yeah, house calls or whatever.
Well, it's not that way now. So you're not going to get
House calls.
even if the personal physician knew you out of 5,000 other people, had great records on you and so on, you're not likely to get that person. So don't even get in the marketplace. You're well, don't do it. Okay, so you need a doctor. How do you get a doctor? How do you find out who's most likely to be the best physician to take care of you? First of all, don't pick a doctor that follows a good diet or doesn't smoke. You don't want a drunk doctor that's dealing with you, but it doesn't matter to you what kind of diet the doctor has, or whether they believe in veganism or the McDougall diet. You don't really care. You want to pick somebody who has the talents that you're looking for. Like, for example, if you want plastic surgery, you want somebody who's an artist. There are too many people who went into plastic surgery for other reasons. They have no artistic talent. You're delivering a baby, you want somebody who knows how to get those little kids out of there, how to catch them carefully. You want people with talent. So that's what you're trying to find out is who you best can get the most talented care out of. And how do you do that? Well, I think a board certified doctor is pretty important. That at least tells you that the physician knows the basic knowledge. I am a board certified internist. Dr. Lim is a board certified family practitioner. And as a result, we took these huge tests, all day long tests, that proved that we had the basic knowledge. Only half of the physicians are board certified.
Yeah, but you had the basic knowledge in taking care of people with medicines.
Yeah, we did. That's what we learned is drugs and devices. But at least I know I got to know the drugs and devices, Mary. Otherwise, I can't add them or take them away. So
okay.
You have to know. So find somebody that's board certified, is located conveniently for you, and has a time schedule convenient for you. And then how do you find out who's a particularly good doctor? Well, I think the best source is a hospital nurse, which you were, Mary. You were a hospital nurse. I started out in the central supply unit, cleaning bedpans in the hospital. That's where my medical career started. I knew everything. I knew who was sleeping with who. I knew who botched what operation. I knew everything. And of course, the nurses, they have even closer contact with the doctor. Nurses see doctors for their best and their worst moments.
I worked in a hospital kitchen and I knew all the stuff too.
Really?
Yeah.
So ask anybody in a hospital, a nurse in particular, somebody who works intimately with physicians. Ask them, who's the best at doing this? They'll tell you. Don't ask an office nurse. Office nurses are loyal to their physicians. So that's not the person to go through. All right, so you pick somebody based on their credentials, their particular specialty and interests that you're willing to buy. Maybe get a few recommendations from friends and family, and really talented recommendations from anybody who works in a hospital, the hospital-based doctor. So now you got to kind of search out what to do. And what I would encourage
a lot of those people, what I'm concerned about when you say, I agree with all that stuff.
Yeah.
But how do you find a person that's going to deprescribe?
Well, that's another level of challenge. First we got to find somebody we can talk to,
Okay.
and that will listen to us. Now, the average office visit is 7 minutes. That's the time you got. So you got to be able to control that situation. I would encourage you to visit the doctor with something pretty benign, like maybe a bad cold or ache or pain that you've had for a while. So you can see whether or not there's somebody you can talk to, deal with their office staff, see if it's comfortable. And then what you do and even on that first visit, I would do the following things. I would make a list. You write it down, the list. If you write it down, the doctor has to deal with it. And that stretches the 7-minute office visit, maybe into a 15 or 20-minute office visit, or maybe not. Maybe the doctor tells you, honestly, look, patient, I've only scheduled 10 minutes here and you've got an hour and a half's worth of questions for me. Fine, doc, here's my list. Give me a call when you get done with your office hours so you can answer all these questions, or I'll make another appointment and pay for it. But I want to get these questions answered. Write it down, make a list when you go in. Okay, another thing to do is if it's something real serious, bring an advocate along. Don't sit in that room alone. You're in the doctor's territory with the doctor's staff and everything. It's imbalanced, the relationship. Bring a friend, a family member, bring somebody along with you to help even out just the dynamics in the room. Now, if you want to get really tough, the best person to bring along with you is your attorney. By the way, I just brought Sally, my attorney, along to listen to this conversation. You'll get attention, I'll tell you that. But realize you have to pay for the time. This is a professional. But the other thing I would encourage you to do is practice saying no. Okay, you have an office visit. Arrive 10, 15 minutes early. Sit in the parking lot and just practice saying no. So it rolls off your lips easily. No, 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 I'm not going to do that, doc. No, because it's so easy to say yes. Anyway, I would get out of the office. I mean, even a prisoner gets one phone call. Don't let the doctor say, okay, you got this particular problem. I have an availability next Tuesday morning at 9 o'clock. Let's do it. No, listen, this is not an emergency, doc. I need some time to think about this, to research, etc. I want to make sure that everything has the greatest possibility of working out. Say no. Get out of the doctor's office and think about it. All right. So when you deal with a specialist, that's a particularly difficult person to deal with. And, 89% of medical students become specialists. Only about 11% become general doctors. So you're dealing with these very powerful specialists who, by the way, everybody's afraid of in the medical business. The nurses are afraid, the dietitians are afraid, fellow colleagues are afraid, particularly when you're dealing with egocentric doctors who are frightened, like cardiologists and oncologists. They're so condescending. You go in and you start asking questions of your doctor. It could be anybody. It doesn't have to be an oncologist or a cardiologist. You go in and ask some questions. What's the doctor say to you? The doctor says, "Who did you go to medical school? I mean, are you the doctor here in the room?" And that way they kind of put you down so they won't ask questions. But if you keep asking questions, you keep studying what's going on and make close observation, you'll see the emperor has no clothes. People in oncology and cardiology, they has the least benefit to offer people and the greatest need to hide that fact. All right. So second opinions. You always want to get a second opinion. Or a third opinion or a fourth opinion. I found another key way to find a really good doctor, not a general doctor, somebody you see in your neighborhood, but say you have something serious going on. Say you have, a need for a particular operation or some kind of treatment. Go to the internet. Look up in the Medical Library of Medicine researchers that are particularly interested in your problem. People who are particularly interested in the problem are going to do a lot of work, a lot of research, try and get a lot of recognition, and they publish in the scientific journals. So what you do when you read a paper, you say, oh, I like the way this guy treats people, this gal. All right, so you look up where they're from, give them a call. You may be able to talk to them right on the phone or email them, a Zoom call, or you might have to fly to another city to see them. But this is the best. The ones that write the scientific papers most of the time. Anyway, the other thing you might say to the doctor, and I've had occasion to say this myself, is, look, doc, if you're considering various options, don't take the radical one. Take the conservative option. That's the kind of person I am. And you don't want to get into a litigious situation with your physician. That your goal should be to have a good outcome and a good relationship. I mean, as Heather will say many times, there are a lot of great doctors out there, and there are a lot of great treatments out there too. But you have to, as a responsible consumer, you've got to take the trouble to make sure you and your family get the kind of care they deserve. And you can with a little bit of effort. And by the way, a lot of these discussions are on my website in a section called Hot Topics Working with MDs. And you know, we have some problems in our profession. Again, you know, we think of ourselves as pretty special people. And it's not right. It's not fair, because you folks are really, really special people. And it ought to be a relationship where there's a bilateral communication, effective communication, and the doctor really does listen and wants to understand what your needs are. It's not one way to treat problems, you well know from listening to us. And by the way, if I didn't say this, I would be remiss, and that is the fact that I think you should take advantage of specialist and standard medical care to see whether it works or not after you change your diet. But do that fix the problem first. Most likely it's due to food poisoning. And you can figure this out in like 4 days, 7 days, 12 days. You know, certainly within 4 months, you can figure this out. And then go see the other guys that offer the real doctors offer the real medicine. Come see us first. And then I bet you'll find you're much, well, we know we've got the data. You know, 90% of people who are on drugs are able to reduce or stop their medications when they attend our 12-day program, particularly those on blood pressure and diabetic medications. We publish this. It's without question. It's what really happens. And people leave with a course where they can get their health back and they can see it. You know, you're left with very, very few other problems that the medical business can deal with, but some real important places in the medical business for their care. So don't overlook that. Don't throw the baby out with the wash water. All right.
Thank you.
So-
Those are some really great tips. Really helpful.
All right. Being in the business, there's one more thing I'll tell you about, and I don't know whether it goes on these days or how much it goes on. It's called ping ponging. Ping ponging, all right? This is where you get into a specialty group and they ping pong you from specialist to specialist until they've gotten as much money as they can out of your insurance company in your own pocket. All right. So you got chest pain, for example. You go see the general doctor. General doctor says, you know, you really ought to see the cardiologist. Cardiologist does his or her tests. Can't find anything wrong with your heart. You know, this could be your stomach. Why don't you go see the GI specialist?
And this is all in the same
Yeah,
building.
this is all the same medical group. Go see the GI specialist. GI specialist looks you over and sticks a scope here and a scope there and does a few blood tests and says, you know, this is not a gastrointestinal problem. Why don't you go see the orthopedic doctor or the rheumatologist specialist? The rheumatologist specialist, you know, says you don't have a bone and joint disease. You know, we've sent you to pretty much every specialist in town, and none of us is taking credit for the fact that we can't help you. We just sent you to somebody else who can either help you, can't take responsibility for helping you or not helping you. Nobody does. They don't want to admit it. And so what do they do as their last resort? What do? They send you off to the psychiatrist and they blame you for the problem. That's how ping pong works. Ultimately, you're the problem because none of the specialists will admit failure or credit. And we're happy to do that at the McDougall program.
Thank you. Our next program is January 12th, and it's filling up fast.
All right.
No, that's not very long away anymore.
It's not.
Especially around the holidays, everything goes so fast.
You know, Mary, I tell you, the markers I use to tell whether a week or a month or a day goes by, they seem to go faster all the time. didn't I just do that yesterday? No, that was 2 weeks ago. So I'm sure most of you know what I'm talking about.
Definitely. Okay, we've got lots of questions to get through. People have been writing in, wanting your input. This is from Sunday. She's doing great following the program. She's lost a bunch of weight, but she has a question about vein ablation with human glue. She has 2 leaky veins in her leg and was wanting to know if this would be a smart idea.
Well, I wish I knew more about it. I've never heard of using human glue. You know, there are a couple different vein treatments that we've talked about here. And this may not apply to the sun.
Like she's trying to plug up her leaks in her veins.
Yeah, but where would they be?
I don't know.
Well, that's kind of what I want to get to, is that the kind of vein treatments that we talk about are separated by the fact that some of them are deep, big veins, and others are superficial, tiny veins. The superficial tiny veins, which they call them spider veins, which go across primarily your legs and are a cosmetic issue, are easily treated with laser or injecting a sclerosing solution. Could be as simple as just a high salt solution, and it destroys the tiny veins and they disappear. So the cosmetic issue is solved without any serious adverse effects. I mean, of course, you got to pay for the treatment, but you know, it's pretty safe to do, and it could be quite rewarding for you as far as taking care of the veins. I've never heard of using glue, but hey, you know, whatever. I'm not trying to indicate it's not a more modern, better way to do it. I just don't know about it. But that's one way to deal with the veins, the superficial veins. And the other way we deal with the veins is we deal with a deep vein thrombosis, where the huge veins deep in the muscles get dilated, and that is treated by stripping the veins. At least that's what we used to do. I don't know what they're up to these days. Hopefully this brutal practice has stopped. You take the big veins out of a person's leg, and you're dealing with a problem that they don't have any way for the fluid to get back to their heart, and they swell and so on.
Glue therapy for varicose veins.
Oh, you see it? Oh, thanks.
Yeah.
Well, it's the same thing as sclerosing agent.
Yeah.
Yeah, it's just something to plug up the superficial veins. And I can't see any reason not to do it, you know. But you should certainly read about the adverse effects from this procedure before you go through it.
Thank you. Okay, since this is a bit of a holiday video, there's a bunch of people writing in wanting to know what you're having for your holiday dinner, Mom.
Well, I'm going to eat the same thing I had for Thanksgiving.
No, we're not having that big meal again.
No, we're not.
No, I think I'm gonna fix lasagna.
Okay, well, that's what I'm having, lasagna, which we had a couple of nights ago for, what was the special occasion? The kids just want lasagna, right?
Yeah, I think so.
There wasn't any birthdays or anything when we had it last time.
No, it's just a request.
Often it's family favorites, and usually we have the lasagna on special occasions like birthdays and holidays and so on. But
So that's
what I'll have.
probably what we'll do,
Yeah.
because we're not gonna do a big, huge mashed potato and gravy and all that stuff.
But if your question is, do I eat turkey on Thanksgiving or Christmas? You'll never know. But you can pretty much assume the answer is no.
Well, for sure, the answer is no on Christmas.
For sure, yeah. Listen, last time you talked about a Christmas tree, Mary.
Oh,
And
yeah.
I'm sure there are people offended by Christmas and cutting down a tree. So explain yourself.
Well, obviously, most of the Christmas trees around the country are grown here in the Northwest. And we actually have an area, and it's called Mount Hood Wilderness Area. And they want you to go in and cut down a tree, because when you thin out the trees, it helps with forest fires. And so you get a coupon, and for $5, they give you a saw, and they tell you to go out in the wilderness and find a tree and cut it down. And so you're doing a service to the forest. And I'm sure there are Christmas tree lots, and where they just grow trees, but this is kind of unique in this area, where you can actually get a coupon and go buy a tree, and you're actually working to thin out the forest, which is, I think, is kind of cool.
That does that does fit in with our environmental efforts. So you can count on it. And then, of course, the one thing she didn't tell you is that the commercial people that get the permit for $5, then they turn around and sell you the same darn Christmas tree for $200. But they went out and got it. They cut it down, they brought it in, you know, so you have to have a service fee. But Mary loves that Christmas holiday and
I
always
just like
loves
the
it.
smell of the tree.
It's been part of our 52 years together. Anyway, we could call it some other kind of tree too. How about a holiday tree?
Holiday tree.
There you go. No one's offended now.
There you go. I like that. That sounds like fun. Okay, let's see. Next question. Lots of questions about food. How do you deal with friends and family during the holidays? Lots of us are going to be at dinners and the question's going to come up, you know, why aren't you eating that? Or, you know, how's your health right now? And what would you recommend people say?
Well, first of all, you don't discuss politics, religion, or what's the third one?
Food.
There you go. So you don't talk about those.
We'll just forget it.
Uh,
I always recommend people bring their own dish, like a potluck. Always ask if you can bring something, so at least you'll have something to eat. But
if you get at the beginning of the table,
yeah,
because our dishes when we go to potluck dinners or family dinners, or well, not family dinners necessarily, but potluck dinners is whatever Mary makes goes first. So get at the beginning of the line because, yeah. Anyway, so don't make a big deal out of it. Just, you know, pass the plate and eat before you go.
before you
Yeah,
go,
there's a good one.
so you're not so hungry, and then it's easy to pick and choose because there's always going to be something.
Yeah.
I would think, and there's not just going to be one big chunk of meat on the table and that's it. There's
You
gonna be some
you
side
probably
dishes.
consume pretty close to what you usually do, and nobody would notice. Yeah. Anyway, we don't, well, of course, in our family, we don't have problems with politics or religion or food. But if you're going to get into a situation where you do, good luck. I hope it's a pleasant day. And then, you know, when somebody finally asks you, well, how did you lose the weight? You look so young, you look so healthy. How'd you do that? Then tell them. Better not to bring it up yourself, though, to start the conversation. But they may ask, you know.
Well, there was this big deal. I mean, I read it in a whole bunch of magazines about how people that were taking Ozempic were supposed to answer questions
Oh, yeah.
at Thanksgiving when they didn't put hardly any food on their plate.
Don't you like my Thanksgiving? Oh, yeah, that would be
Yeah.
a problem. So if you're on Ozempic, maybe you want to quit. Maybe you want to quit a couple days ahead of time, so you don't offend the other people at your dinner, or especially the host, especially the person who took all the trouble to make that meal. And that was one of the suggestions, wasn't it?
Yeah.
They quit your Ozempic ahead of time, which are GLP-1 agonists, which are derivatives of reptile poison. They poison you. And with a lot of very serious side
The
effects.
article I read said it wouldn't matter.
No,
You just quit for a week.
you know, you just stop throwing up for a week. Stop the nausea and diarrhea for a week. You get right back into it, folks. You may be less willing to get back
Yeah,
into it.
maybe it will make you feel better or good enough that you decide it's not worth it.
The McDougall diet is the anti-Ozempic program. You know, we have everything to offer to counter this Ozempic movement, because this kind of very successful financially movement of poisoning people with reptile poison to cause them to lose their appetite and to lose weight at a cost of $1,000 a month. The people need to realize the only reason they need to take this medication, even for diabetes, is because they eat the Western diet. And most of you can fix this. So you never have a weight problem again. When I talk about most, I'm talking about 99%. So you never have to worry about gaining weight again. You never have to worry about becoming diabetic unless you've already destroyed your pancreas. You know, there may be some residual there, but hey, folks, you got a choice. You can Eat to the fullness of your appetite, stay trim, stay healthy by eating starches, vegetables, and fruits. You can eat meat and dairy and oil and be sick from the foods, and then take medications that make you more sick. So you won't even eat the sickening foods.
But you know, we hear all the time from people who one of the people in the family is doing the program and they're doing really well. And their partner or even their siblings or their relatives that live with them are not doing the program. And they say, it doesn't matter how bad I feel. I don't care. I'm not going to eat that stuff that you're eating. And so, I mean, you can't do anything about people like that.
Keep educating them. Don't give up. You know, I can think back of Heather's grandparents. You know, her on Mary's side, her dad had to almost die of heart disease and prostate cancer before he decided, hey, I've had enough. Even a little bit is too much. And my dad, and by the way, he lived another 23 years from the time that he was so sick, he was almost dead. My dad, it took a lot more. I mean, he was a tougher guy, I guess, before he decided to change his diet, and he almost died of heart disease. He probably lost 80 to 90% of his heart muscle, but he changed, you know, he changed all. It was a slow, gradual process. Had bypass surgery against my best advice, but anyway, he lived 11 years once he decided to change his diet. 11 years more in great health, great life.
I remember that.
Let's get back
to you guys getting them to transition and, you know, trying to get them to eat the food. And it was a struggle even for them, but they did it.
They did it, and they got good rewards and lived to be, what, your dad was
My
93?
dad was 93 and my mom was 99.
My mom was 93 and my dad was 81.
Yeah, he did.
81. But he really worked hard at destroying his health before I figured all this out.
Thank you. Okay, next question. This is from Angela. She has been eating plant-based, no oil for 20 years. She's at a healthy weight. She's 54 and she's wondering if it's okay to eat bread every day.
Well, why don't you do it and see what happens? You know, the consequences of the possible consequences is when you eat bread as opposed to the original wheat berry. See, you make flour out of wheat berries, so you grind them up. But what you do is you change the calorie concentration from 1 calorie per gram to 2 calories per gram. When you grind up the flour, what happens is instead of having a surface area like this of the wheat berry, you grind up the flour and you increase the surface area thousands fold with all this powder with flour. So it's more rapidly absorbed. And so you're going to be taking in more calories. So it's going to be less efficient for you losing weight. However, I told you all about the story about Michigan State University students, overweight students who were asked to eat 12 slices of bread a day for 2 months. And the average weight loss was 14 pounds. All they had to do was eat the bread for white bread and 19 pounds for brown bread. So I wouldn't worry about adding bread in terms of weight loss, but do realize if you rapid weight loss, the maximum weight loss program that we teach does not include flour products, just for those reasons. Okay, the other issue is there's a lot of gluten in wheat, barley, and rye. Those who are gluten sensitive, have celiac disease, they're going to have trouble. But it's even possible for people who don't have celiac disease, who have a tendency towards creating malabsorption with gluten. Okay, it's not really the full-blown problem, but if they eat like 2 or 3 pounds of bread a day, they can get into problems because a relatively normal, healthy person can. Let's see, other reasons. Otherwise, I don't see any particular problem having bread every day. If bread is the staff of life, I don't know how it got the reputation of being the staff of life if it was so bad for you. The breadbasket of the world describes an area that includes Iran, Iraq, Egypt, and now Ukraine. It's the breadbasket of the world. It's not the pork chop basket of the world. So bread's got to be pretty good. You know, bread has been a staple for hundreds of millions of people throughout history. And of course, we have the idea that potatoes are fattening and bread is fattening, and it's just nonsense. You don't stand a chance if you live in an environment of lies. And of course, these lies are created by people who make profits from lying. I mean, that's what happens. And that's primarily the food industry, backed up by the medical industry. Because, you know, if you can make people sick, what do you have to do? You have to treat them. So you need hospitals and doctors, and you know, it's just a downhill twist that doesn't help anybody except for those making money.
Thank you. I love bread, so I'm going to keep eating it.
And you know, the reason, just like with the potato, the reason bread gets into trouble is because, you know, you put a 1/4-inch slab of butter on it, or, you know, a 1/2 inch of cheese on it.
Yeah.
That's why bread is bad. Just like the potatoes, it's the bacon bits and the sour cream and the butter that you put on it. It's not the potato. So, you know, put a little jam on your bread. Again, I would watch for a tendency to lose weight slower adding the jam, but not so bad.
Thank you. Can you talk a bit about omega-3 fats and glaucoma?
Oh, yeah. Thank you. There's some research that I have that you can find under vegetable fats, I believe. If you look at the website, it's under Hot Topics, Nutrition and Vegetable Oils. And it's an article about how vegetable fats, you know, omega-3 is what falls in the category of a vegetable fat. Vegetable fats are easily made rancid. They're oxidized. And the oxidized rancid fats contain a whole bunch of free radicals, which means you have extra electrons in the molecule. And when it comes in contact with tissues like the lens of the eye, it causes damage. All over the body causes. Free radicals cause damage all over the body. Free radicals occur as a consequence of oxidation, particularly of fats. They turn rancid. So the idea is that polyunsaturated omega-3 fats, because of their tendency towards free radical development, will damage the eye and cause cataracts. But I think more likely it has to do with galactose. I think galactose is the cause of cataracts. Galactose is a derivative of lactose, which is cow's milk sugar. Lactose breaks down into glucose and galactose. People who have hypergalactosemia, condition called galactosemia. It's a genetic situation where people can't metabolize and get rid of the galactose, and it builds up in large amounts in their body. One of the earliest signs of this disease, and most severe, is that in their teens, they develop dense cataracts. You know, they go blind. You know, fortunately, cataracts can be treated, but you know, so I think likely it's you know, the whole diet, but in particular the dairy foods that people consume that damage their lenses.
Well, you know, are you finished with that? I want to ask you a question. You said something about rancidity in oils. Well, don't like wheat berries and other things, they also turn rancid after they've been ground.
Right, after they've been ground. After you break the shell off,
Yeah.
the protective shell, then you expose to the air or oxygen, you expose the fats. So it becomes rancid once you grind it, yeah.
Because I remember when we lived in Hawaii, we lived in that old plantation house.
Mhm.
I bought this really old fashioned refrigerator, and we stuck it way on the corner of the porch.
Okay.
And I kept all of my ground.
Oh, yeah, I remember.
Remember, I kept all my wheat, all my barley, everything that was ground was kept in this refrigerator because it was so hot there that if you didn't keep it in the refrigerator, you'd open it up and you'd have bugs flying out.
Yeah.
Because of the heat.
That was 52 years ago.
I know. But I still remember what that refrigerator
now
looked
that,
like.
now that you mention, I remember the refrigerator well. So,
Thank you. Okay, next question. This is from Crystal. She has a son who's 21 years old. She says he eats pretty well, but he's underweight. What would you suggest to someone that wants to gain some weight on the McDougall program?
but first I'd make sure that he's okay, he's healthy. You know, sometimes people have problems with gaining weight because they're not well. They have autoimmune diseases, cancer, malabsorption problems, you know, like celiac disease, which would be a reason to be too thin. So, you know, find out if there's any kind of medical issue going on and a good general practitioner should be able to do a basic evaluation for you. Then the next thing to do is I would think about his physical activities. There are a lot of really thin athletes out there that are working hard. They just can't take enough calories. No, I mean, think about the winners of the marathons in Chicago and New York and Boston and Honolulu. I mean, they're the skinniest Kenyans and Ethiopians you've ever seen. Is that the kind of thinness your son is? Like an Ethiopian or a Kenyan that wins marathons? I bet he is. I bet he is. These people are in great health, obviously, because they're the winners. So he just may be a typical, you know, athletically oriented, high output calorie type person, and that's not a problem. On the other end, because for some reason or another, you want him bigger or fatter, a little bit of
More bulky.
yeah, whatever you find it more attractive and less worrisome to have your son weigh a few extra pounds. Well, I would feed him the opposite of the maximum weight loss program that we teach. In other words, I would hit nuts, nut butters like peanut butter, tahini butter, seeds. Seed, is that tahini? Seeds, tahini?
Mhm.
Yeah, so
Sesame seeds.
sesame seed. Okay, you know, that kind of thing. Nuts and seeds and avocados. I'd make sure you had a good dose of those. They're safer than free oils. You can accomplish the same thing by getting corn oil, olive oil, or something. But oil is an isolated concentrated nutrient that is not protected by the ingredients of a plant, like a peanut or a walnut or an avocado. They have all kinds of ingredients that make sure that oil that you eat is not going to hurt you. But you throw all those other things away and you end up with just pure oil. Not so good. You gain weight. Flour products. We just talked about doubling the calorie concentration of a wheat berry by grinding it into flour. That'd be another things to do. How about I know what the problem is. The problem is you changed. No, I'm not going to say it because I can't assume that you did. But this happens sometimes. Is you change your own diet or your diet of the family. They don't like the food, and so they lose weight because they don't like the food. Because they're not. So what you have to do is you have to make the food more familiar to your family's taste buds, like the kind of spices that they're used to getting, and salt. A little salt on the surface of the food or a little sugar on the surface of the food makes it as palatable as anything you've ever served them, because what you left out were things they wouldn't eat anyway in their natural form. Nobody eats raw chicken or even boiled chicken or uncooked beef. I guess they do, but pretty bizarre. Anyway, make sure that the family likes the food. And then the next step, once you find out what your family likes, is make sure it's available. If you're not preparing the food, what do you expect? I don't know teenagers, many of them, that will lend their talents to the kitchen and survive themselves. They'd rather starve than work. So, you know, making enjoyable food available for your son, higher fat foods, more breads, bagels, and pastas, and he should do stuff fine. But then again, he might not be able to keep up with his athletic endeavors. The Kenyans and the Ethiopians that win the marathons don't. And I'm sure they eat all day long ugali, U-G-A-L-I, ugali, which is a corn porridge, which counts for 80% of their diet. So
Well, just like Jason, he eats all day long. He doesn't gain any weight.
Jason is Heather's son, who stays with us quite a bit of the time. Yeah, I wasn't going to mention him as an example, but he's really trim. And you and I are really trim too.
Yeah.
We'd probably by most people be considered too thin.
Probably.
Certainly, we'd never get hired as an actor for the Ozempic commercials. I don't think I could sing as well as that overweight lady does.
Or dance.
Because that's Ozempic, isn't it? The one's
No, that's Jardiance.
Jardiance. I think all kinds of overweight dancing people on all these ads.
The cute ad.
We better keep our day job.
Yeah, we better.
Definitely. Okay, next question. This is from Katie. She's a 78-year-old female diagnosed with GCA. The rheumatologist is recommending the infusion Actimera. She's on prednisone. Just wants to know if you have any comments.
I don't know. I don't know what GCA is an acronym for something.
I looked it up. Giant cell arteritis.
Giant cell arteritis, right?
Yeah.
Giant cell arteritis is not treated effectively with the diet. Okay.
It's not.
No, I've taken care of, many dozens of people with giant cell arteritis, which is,
What is it?
it's an inflammation of the artery, which goes over this artery in particular, the temporal artery. It's also called temporal arteritis. And the thing is that this particular set of nerves can go into the eye and cover the surface of the eye. And you can actually go blind from this condition.
Wow.
And the research says, and the recommendations are, and I have no reason to counter them, is that you take steroids for a year. And most of the time after a year, you can get off the steroids and everything's okay. Not always. And don't you think the diet's going to fix that problem? It's not. That's at least as far as I'm aware of. So.
Well, I guess there are some things that diet just doesn't
I
fix.
guess so, like
Broken bones.
broken bones. Doesn't fix it.
Thank
Yeah, okay.
Bowling ball.
The
and-
prednisone, the things that her doctor is recommending are probably.
That's prednisone steroids.
Yeah.
That's the proper treatment. Okay. And I have no reason to think you should not do that. I think you should do it unless you find out otherwise or decide otherwise. It's not without adverse effects. So you take steroids for a year, you have a tremendous bone loss and a tendency towards broken bones and osteoporosis. Steroids cause a Darwinian hump because of fractures of the spine. People can't get it bent over, and steroids increase your risk of cancer. So it's not without consequences to take steroids for a year, but going blind is not a good thing too. And there is evidence if you don't treat it with steroids that you could go blind.
Thank you.
You should change your diet also. I mean, good grief. Use this as a teaching opportunity. Everything Dr. McDougall says, I'm not going to believe. I'm going to believe it has to do with diet. So this is the final straw. I'm going to change my diet. Diet is the foundation of everything. Even if you drop a bowling ball on your foot, you still need to eat a good diet.
You don't just want to be served carrots.
Thank you.
Okay.
Okay, this next person wrote in, they have angiodysplasia in the small intestine. They have low iron and red blood cells. The
Guys are really
gastroenterologist wants to do ablation on these internal veins that bleed.
Well, what I assume from your discussion is that this person has a whole bunch of superficial veins that are bleeding and resulting in an anemia. And the only way you can control it is destroy this collection of veins that are superficial. And that's what they want to go in and probably be cutting it out or burn it with a laser or electro cautery or some way to stop this bleeding. And
And that's something you have to do.
well, I'm not sure because I don't know that much about it, Mary.
Okay.
What I would do is I would figure out, I would see whether or not, I'd learn about the treatment proposed. And I'd see if there's any relevant studies. This is a real unusual condition. So there's probably not any randomized controlled trials out there. And then again, I would go look for the person who is best able to give me the care that I'm looking for, which is success. So how do you find this person? This is a real rare problem. Look it up at the National Library of Medicine. And you find people who've written papers on this particular venous abnormality of the intestinal tract. And you go, oh, Dr. George Allen here from, well, not in my next hometown. I'll go see him or her or whatever. Find the people who are likely to be the most talented, which are the ones that write papers about your problem. I'd do that, at least for a second opinion. And then you may go back to your original doctor. But, and you want to ask, if you're going to have this done, you want to ask, well, how many similar procedures do you do a day? Oh, well, I'll probably do like 6 cases a year. Well, I don't want you as my doctor. I want somebody who does 6 cases a day, which involves a gastroscope, I imagine. Doesn't have to cauterize the veins. That would be a big plus, but I want somebody who does this all the time. And again, I don't care whether they eat the Atkins diet or smoke cigarettes or whatever. I don't really care. You just be the most talented person out there to help me.
Thank you. Let's see, Angela wrote in, she's vegan, trying to be a really good influence for her family. She's raising her 5-year-old daughter as vegetarian, and people are giving her some flack about that. And what would you say to a
I went
parent?
through that, right?
Oh, yeah.
Yeah.
You went through it yourself and with your kids.
Mhm.
You're dealing with an awful lot of ignorance. But there has to be a lot of ignorance out there. I mean, look around you. If people knew what to eat, you wouldn't see 80% of the population being overweight or obese. Half the people being pre-diabetic. People dying of heart disease and breast cancer and prostate cancer and colon cancer at near epidemic rates. So what the advice that they have, the recommendations they have on what to eat are obviously wrong. So, if the person who is criticizing you is interested in the information, I've written down all the information. If you just have the Starch Solution book and get them to read that, there's a chapter on when friends ask where do you get your protein, when friends ask where you get your calcium. There's all kinds of basic information that should reassure even the casual reader that not only is this a safe way to eat, it's the best way to eat for children. You feed a child human breast milk exclusively for 6 months. No water, no food, just the boob for 6 months. And then what happens is the child develops coordination in his or her little hands and teeth to chew and reaches out into mother's hands and grabs whatever she's holding. Hopefully you're holding potatoes or applesauce or something like that, not a chunk of beef. Then what happens is you decrease the amount of breast milk and you increase the amount of solid starchy foods, fruits and vegetables over the next 2 to 3 years of the child's life. And you decrease the milk, increase the solid food. And finally at 2 years of age is old enough, but I would have probably compliments for the family that decided to breastfeed longer. There's no hard rule at 2 years. If you and the child are just doing fine, the family's just doing fine with this comfort time and nourishment time for the child, you don't have to stop at 2. I think probably 5 is old enough. That's my personal bias.
I made it to 3.
I suppose you did.
And Heather did, I think, also.
Yeah. And then you feed a child starches, vegetables, and fruits. After the age of 2, there's good reason for the child to be on higher fat plant foods. Some peanut butter, some avocado, there's a good reason that a child should not, certainly not below the age of 2 should child's fat be restricted. Breast milk's 50% fat. Half the calories are fat in breast milk. So they're on naturally a high fat diet for the development of the tissues and the energy and et cetera. So, but when you slowly and gradually transition from breast milk to solid food, at least below the age of 2, and you're pushing it, I think, you should add high fat plant foods to the child's diet. When do you stop doing that? When the kid becomes fat, obese, then you've overdone the nuts and seeds and avocados. But as long as they're doing okay, then you're probably giving them enough calories.
So they're usually getting a lot of energy. They're working out, they're playing, they're using up energy. So
And you can't, there's no way you can take and count and figure out what the child's particular needs are when it comes to food intake. Fortunately, the child has something called an appetite. They get hungry and that takes care of it. You know, they play hard one day, they eat a lot of food. They sit around, do homework the next day, they don't eat so much. Hunger drive takes care of you. Keeps your weight stable. You stay at a set point based upon the foods you eat. If your set point is really big, in other words, you're too fat, then you need to change your set point. And the way you do that is by changing your food. Then your set point becomes a trim person. That's all you do. You know, you don't do it. All you have to do is change the food. You don't have to be a good person. You don't have to pray to anything or anybody. You just fix the food. You don't have to think good thoughts. Just fix the food.
It just sounds too easy.
Grief. I don't care if you even like us. Just fix the food. It is just, from our point of view, it is just so ridiculous that there's so much suffering going on with what appears to be ignorance of the problem. I just can't believe that many people could be that ignorant about what's going on. But somehow or another they seem to be, and I think the problem is in part tradition. I think in part it's where the money is. And I think it's part the fact that people learn to eat a certain way and they defend their own personal eating habits. It's hard to change, but it's long overdue. There's not a knowledge problem here. It's not a matter of knowing what is the best diet for people, or at least a diet that's darn close to the best diet for people, which we believe ours is.
Thank you. Okay, next question. This is a good one. I'm very disappointed that you give diet, health, nutrition advice and then say it's okay to get vaccinated.
Well, I also say it's okay to wear seatbelts. Is that okay? Is that okay? I think they're pretty unrelated. Food, vaccinations, and seatbelts. So why do you ask me to put all three of them together and think that some person who fails to recommend one is going to fail to recommend all three? They're not equivalent, ladies and gentlemen. Okay? No, I'm not a perfect person in your eyes, obviously, but I am based on the science, pretty darn close. I believe in science. And I'm not here to win a popularity. Do you think I'm here to win a popularity contest?
Never have.
I've been at this for 47 years, and winning a popularity contest has never been on my list.
Never
of
been.
things that I want to
Never
accomplish.
been on the list.
But I
But
think you're
was
clear about vaccinations, and there's some that you recommend and some that you don't, and that's
Yeah.
important to talk about.
I only recommend the ones that work. Just like with drugs, I only recommend the ones that will do you more good than harm. You know, or seeing particular doctors. I want you to see ones that'll do you more good than harm. That's
The same
fair.
thing.
It's fair. Yeah. So I'm asking you to. And it turns out that clean air, clean water, and clean food are the only things that I know about which cause no harm. Everything else causes harm. There are adverse effects to running, to sunshine, to drugs. Everything I know has adverse effects to it except for clean air, clean food, and clean water. We teach clean food.
Thank you. I think that's a good thing to end on. It's been an hour. Thanks,
that's
Mom
fun.
and Dad, Dr. McDougall and Mary.
Oh, good.
Happy
You guys have
holidays, everyone. We will be back on January 7th. So we'll miss you.
And-
but
people still have time to sign up for the program. And a great Christmas gift might be the 5 2-hour lectures that I put on diet therapy. You might consider it, you know, but don't buy it for anybody that won't watch it. I mean, I would be disappointed if my work went to that. We don't need the income. We just were trying to spread the message. And if you find somebody that really, really wants to know what you do, or a professional, in particular, a dietitian or doctor, you know, physician, this may be just what they needed to change their lives and their practice and thousands of people. So think about that set of 5 lectures that I put together this year. All right.
all right. Thanks, Mom and Dad, Dr. McDougall, Mary. Thank you, everyone, for tuning in. Happy holidays, and we will see you January 7th. Take care.
Okay, bye-bye.